welcome to the webinar today, everybody. We have PCPCH site visits, what to expect. We're going to get an overview of the OHA PCPCH program site visit process, including talking a little bit about the PCPCH foundational concepts, the pre-site visit process, key components of the actual site visit, and post-site visit follow-up work and support. We do have a lot of people on the phone line today, so everybody is on mute, but we do want to hear your questions. So if you want to type them in as we go through the presentation today, that's great. I can have them all ready to go when Q&A starts. You'll do that in the questions pane on the GoToWebinar control panel. Before I turn things over to the presenters, I want to tell you a little bit about the Patient-Centered Primary Care Institute. The Institute is a partnership with the Oregon Health Authority to get technical assistance and information out to folks working on the PCPCH model of care. We get technical assistance out in a variety of different ways. Hopefully, many of you have checked out the online learning modules available through the Institute website. There are recordings of webinars like this one available on the site, as well as an email list that you can register for to get updates and information on future both in-person opportunities and then online opportunities as well. So we'd encourage you to visit the website, pcpci.org, to get more information. I am going to introduce our presenters today. First, we have Dr. Evan Salino, who's a family physician at a Safety Net residency teaching clinic in Portland, where approximately half of his patients have private insurance and the other half have Medicaid or uninsured. He received his undergraduate degree from the University of California, San Diego, and his medical degree and PhD in microbiology from Washington University in St. Louis, Missouri. In addition to seeing patients in the clinic, he works on a variety of health policy, advocacy, and communications issues with groups such as the Oregon Academy of Family Physicians, as well as with legislators in Oregon and nationally. Through his position at Providence Center for Outcomes Research and Education, Dr. Salino acts as the clinical advisor for the PCPCH program, working to bridge the gap between policy and practice. So we're really happy to have him on the line today. Another one of our presenters is Meg Bowen. Raised in Southwest Washington, Meg recently returned back to the Northwest after working in Boston with the Informed Medical Decisions Foundation, implementing evidence-based practice tools in primary care and specialty care practices across the country. She has clinical experience in emergency medicine, primary and specialty care, first as a medical assistant, then as a nationally registered paramedic and instructor, along with experience in clinical data management and implementation of evidence-based practices. She's also a certified decision support health coach and is really happy to be working with innovative practices in Oregon and around the Northwest. And finally, we have Chris. Chris has worked in healthcare since 1998. His roles have included delivering direct patient care in family medicine, urgent care, emergency medicine, outpatient surgery, and medical surgical oncology units. He was an Epic analyst for oncology and ambulatory clinics, a quality improvement coordinator, and a clinic manager. He holds a Bachelor of Science in Healthcare Management and a Master's in Public Administration. His passion for high-quality patient-centered healthcare while providing quality improvement and project support, or he developed his passion for high-quality patient-centered healthcare while providing quality improvement and project support for a medical home pilot program with local medical group in Oregon. As a practice enhancement specialist with OHA's PCPCH program, he participates in site visits throughout the state and provides practice support to help clinics meet PCPCH standards and improve patient care. With that, I think I'm going to turn things over to Dr. Evan Salino to talk to us about the objectives of the webinar today.
All right, great. Thanks a lot, and thanks to everyone who's joining us nice and early this morning. So for the learning objectives to the webinar, first of all, we're just going to go through really briefly the core attributes and basic structure of the PCPCH program. And the reason we're doing that, you all may know these things, but the reason we're doing that is the visit process really focuses on these core attributes. And so we want you to understand those connections. We want you to gain familiarity with the three parts of the site visit process. What happens before the site visit? What happens during that site visit? And then, importantly, what happens after the site visit as well. And then the last part is really just to learn about what your role is in the site visit process and how you can really make it a valuable experience. So if we can get the next slide, there we go. The core attributes of the patient-centered primary care home program in Oregon are these. There's a little house diagram that I love on the bottom there. And the way we think about these and the way we really approach this in terms of the site visit is thinking about this as a clinical model of care, thinking about this as really a patient journey through care. So, you know, starting out, a patient is at home, they need some help, they need some guidance, so they want their care to be accessible. They want you to be there when they need you. And so, you know, obviously there's standards and measures below this core attribute of access, things like constant access to telephone advice, things like in-person appointments, things like asking patients how they think access is, those sorts of things that are really that first part of getting care. Then once they're in the clinic and actually getting care from you, you want to provide them the best care possible, right? So in order to do that, that involves things like looking at information, knowing your population, looking at data and trying to improve on data and processes, involving patients in that improvement experience, things like that, right? The other part of patient-centered primary care, really, you know, high-quality primary care in general, is thinking about the patient as a whole person, you know, in their community, doing the things that they normally do, not really just thinking about them as an organ or an illness, right? So that involves thinking about preventive care, thinking about screening for things in the population, in your whole population, things like mental health issues, substance abuse issues, thinking about other health risks that you know, can affect health certainly in folks, really providing them a comprehensive services that can hit all of those different parts of care, the different locations that people get care in the healthcare system. And that really leads into that aspect of continuity, right? So caring for people over time. This is one of the most evidence-based parts of patient-centered primary care work. And continuity is, you know, first of all, just knowing a patient over time in your clinic, having an established relationship and growing to know them, the team growing to know those folks. But it's also continuity in space. So thinking, again, about where folks are going elsewhere in the healthcare system, things like the hospital, specialty care, sharing information about care to make sure everybody's on the same page, which really leads into that idea of coordinated and integrated care, which is all of that care that happens, all the things that happen outside of your clinic. You know, how are you proactively reaching out to folks to make sure that they get the care they need? How are you coordinating their care when they need help? Again, how are you coordinating transitions of care between hospitals, skilled nursing facilities? How are you thinking about care at the end of life when there are other people involved, potentially things like folks like hospice and folks like that? And then the last part really is that thinking about patients when they're not with us 99.9% of the time. How are we communicating with them in a way that they understand? How are we providing them with tools so that they understand their health issues and can manage them better? And then how are we involving them in, again, this improvement process, asking them, hey, how can we do better? So that's really that clinical model of care, and so we are assessing standards and measures that fit below this, but when we're talking with folks, when we're interacting with folks, it essentially leads back to this, what would the patient's experience be if they were getting care in this clinic? That's what we're trying to assess. So I want to just introduce you all to our PCPCH team, which is it's getting big, which is great. We're really excited to have all these folks on board. Nicole Merrithew, who's in the center there, is the program director. Deepti is over on the left, on the bottom. She does a lot of the data work and application work. Jill Boyd, who was Jill Curry, some people may know her as Jill Curry, and Chris Carrera there in the back. They are our practice enhancement specialists. We'll talk to you more about their role. Heather Wilson and Meg Bowen, there in the back row, separated by Chris. Those folks are our site visitors, and we'll talk more about their role. And then Amy does a lot of our communications work and that sort of thing. But it's really wonderful to have them on board. Everybody brings something to the team, different experiences, different expertise, And it's really has created I think a great tool really for clinics to be able to use going forward. I'm not in this picture. I got out of that photo. All right, so then really I just want to, before I hand it over to Meg, I want to talk about really the purpose of the 3 purposes of the PCPCH site visit. So it is called a verification site visit, and a really important part of the site visit is that verification piece. So this is a self-attestation program. All the clinics who are recognized went on the application website and put in information about saying we are doing these things. And so certainly an important part of the integrity of the program and really the integrity of your recognition that you receive is making sure that you're just doing the things that you've said you're doing. So there is that aspect certainly to the site visit. But importantly, there are these other 2 aspects. So the second aspect is really an assessment. So that's provided by the whole team, sort of saying, hey, where are you all at in terms of this PCPCH care? We recognize this is a journey. There's no clear end destination. Where are you at? Where are the things that you're doing well that maybe we can share with other folks with sort of best practices? Where are the barriers that you're coming up against that may be common barriers that other folks have come up against? And then the last part is that collaborative piece. So one of the things that we recognized when we started doing site visits pretty quickly that it didn't matter where folks were at in this journey of doing this work, if they've been working on it 5 or 6 years or 5 or 6 months, everybody needed help and wanted help. They just needed help with different things, potentially. And so we built into the site visit this collaborative aspect of providing that at-the-elbow support if you need it, hooking you up with tools or resources or maybe peer mentors, other folks in your area or the state that have figured some of these things out who can help you do the work that you want to do. And that is really a critical piece that we've really we're really putting a lot of effort and emphasis on this part, again, because really our goal is to move patient-centered primary care forward across the state of Oregon. Our job really is to help you guys be able to do that, and so this piece is really critical. With that, I'll pass it over to Meg.
Great. Thanks so much, Evan. Hi, everybody. This is Meg. So who's coming to your clinic? I'm going to go through who the members of the site visit team are, and Evan has just gone over the photograph, so you kind of have an image in your mind of what we look like. So we have 2 site visit teams so we can tackle the nearly 500 practices in the state that have attested to the PCPCH measures, which is awesome. So there are 2 of us who are site visitors, and that's myself and Heather Wilson, who she's based in Springfield. And we go through, when we meet with various members of your team during the day, we review and verify your documentation. So we're also going to be working with you up front before the visit even happens to help you gather your documentation and get it all in place. The second part of our team, those are our practice enhancement specialists, or PES people. That's Jill Curry or Jill Boyd and Chris Carrera sitting right next to me right now. Those are our practice enhancement specialists. And they're going to be meeting with members of your team as well. They're going to verify the functionality of the PCPCH standards that you've attested to. So whereas the site visitors, Heather and myself, we're going to be looking at the documentation and how that's put together. Chris and Jill are really going to be talking about, so how does this work? How does this work in your clinic? Who does this? And it's really very conversational and actually pretty fun. They also assist with technical assistance and follow-up after the site visit. So they're going to be a great resource to you moving forward after the site visit, should there be measures that you need to kind of firm up, or there's new measures that you want to attest to in the future. And the last component is probably the most important component of this team, and those are our clinical transformation consultants. And these are all physicians. They've all been through this process, and they've been hand-selected for these site visits. They're based across the state, so you're going to get a local provider that's, and most times you're going to get a local provider who's familiar with the CCO, who's familiar with how things work in your area. So if you're way out in Christmas Valley or out in halfway Oregon, we're going to try our best to find a provider that can be a CTC or clinical transformation consultant to come and work with your providers at your site. They provide the clinical perspective of this transformation work, and they also assist with the verification and functionality of our standards. So during the day, they're going to be circulating around and going to various meetings. Okay, so step one, congratulations. Your site has been selected for a site visit. So we had a little tongue-in-cheek here with Bob Barker. Come on down. So what will happen is your clinic will receive a letter via email explaining the visit, and it's important that you keep breathing when you get this email from us. Like I said, we have almost 500 sites in the state that have attested, and we're going to be visiting all of them through the years. So we try to give each site 4 to 6 weeks notice that we're going to be coming for a site visit. And then we're going to want to schedule a call with you just about a week or so of receiving this email and this letter so we can start the planning process. What we're going to do is we're going to just have a meet and greet on the phone. It'll take about 30 minutes. We're going to go through an agenda for the day, explain how the day will go, who we need to have involved on your end, and also line up who's going to be our main contact moving forward. We're going to tell you what you need to pull together prior to the visit as far as documentation is concerned. We're going to talk about what is needed on the day of the visit, what kind of documentation we would like to have there in place as we go through and verify the measures that we're attested to. And then, of course, that primary contact. And also make sure that your clinic hasn't moved, because a lot of the sites have attested sometimes a year ago, and a lot of things happen in a year, as we all know, in the clinical world. Okay, what will the visit look like? So our site visit team members will meet with different care providers, and these are short 45 to 50-minute interviews. This is so we don't monopolize one group for the entire day. Our intent is not to shut your clinic down for the day at all. We thoroughly want your clinic to proceed as humanly possible during the day. So we will be meeting with different folks. So we'll be meeting with dyads. We'll also be meeting with anybody who does triage or scheduling, anyone who works with appointments. So another component of this is a chart review. So we would like to sit with whoever can walk us through your medical records, whether they be paper or electronic. And we'll need to have somebody who understands clinical care. Doesn't necessarily have to be a clinician, but somebody who understands clinical care, but can also think back. And if I were to ask a question, and we do this all the time with scenarios, I'll say, can you show me an example of somebody in your clinic who has been referred to hospice? And so that person we want that person to have an idea. Nothing is worse than when you're at an electronic medical record and somebody's asking you questions and your mind goes blank. I can't think of anybody who even had a tetanus shot in my clinic, and I've got maybe 5,000 patients here. So somebody who can kind of navigate the chart review with us is great. We don't need to have personal access to your medical records at all. We will sit with someone and go through that. I think probably the best part of the day is the patient focus group. Now, our practice enhancement specialists, Chris and Jill, they get to run that group. So we will encourage you to reach out to around 6 or 8 patients in your clinic. We hope to have 4 to 6 be able to come in to attend a 45-minute focus group. It's usually during the lunchtime hour. And this is where the practice enhancement specialist will go through and ask questions pertaining to the measures. Things like, how was it to get access? Have you had to call after hours? What was that process like? Have any of you been referred to a specialist? What was that process like? And it's very conversational, it's easy flowing, and everybody talks together as a group. It's not a one-on-one interview. Because it's held during the noontime hour, it's not uncommon for practices to pull together juice or drinks or snacks or something. It's not necessary to do that, but it's not uncommon to do that. We went to one clinic, and it was a really good move on their part. They had patients who already were coming in for a visit that day come in for the focus group as well, so they didn't have to make 2 visits. We'll also meet with the clinic leadership to kick off and close out the day, and that leadership can be whoever is defined at your clinic. And the visit usually starts at about 8:15 in the morning, and we're done and out of your hair by 3:15. So this is an example of what the site visit agenda will look like. I will take this document after our initial 30-minute phone call. mock it up with who our team members will be for your visit, and then send that to you, and I'll highlight the areas that we need to have you fill in. And then we need to get that back so we can circulate that to our site visit team members so we're aware of who we're meeting with that day. But you can see it's a pretty full day. And again, we try to be as unobtrusive as possible, if that's even possible. But so before the site visit, it's important that we have you prepare your documentation. Now remember, when you applied online, there was this binder that you pulled together, and it was suggested that you keep that binder. So I would suggest, if you get a note saying we're coming for a site visit, take that binder off the shelf, blow the dust off of it. And we're also going to walk through a document called Preparing for Your Site Visit. You're going to get that when you get your email saying we're coming. It's important that you read that document cover to cover, because we're going to cover that in that 30-minute phone call. But it will tell you the documentation that you need to submit before we arrive. And you can do that in a couple different ways. You can do that electronically, which is the preferred method because we are staggered all over the state here, and it's easier to share that way with other team members. Or you can submit that in hard copy, and that information is all contained on that Preparing for Your Site Visit document. Another component is that we need to have you complete a pre-site visit survey, and that's just a link through SurveyMonkey. We're going to send all of this to you when we have our 30-minute phone call. So we're going to remind you to complete that pre-visit survey as well, and then recruit those patients for a focus group. So again, an average of 4 to 6 patients in attendance, 45 minutes typically during the lunch hour. It's not necessary to pay them. We also can provide you with a document that will help with that too. So it's really, really important when you're pulling together this documentation for us. We know it's a lot of work, but it's very, very important that you practice good HIPAA hygiene and de-identify that information that you email to us. So we do have secure service here at the state, and if you mail it to us, it does stay under lock and key. But it's important that you take a big black Sharpie and mark out any kind of identifying information on those medical records that you send. It could be a screenshot, it could be a list of patients. So if you have any questions at all about how to de-identify or what exactly we need to send, just please reach out. But it's important that you do that. We all practice good HIPAA hygiene. So if you need to brush up on the PCPCH standards, we have the modules on the foundations of the PCPCH program and each standard, and it's on the pcpci.org website under online modules. The hyperlink is on the slides, and we'll make sure that everybody gets that. You can go to it right from the homepage of the PCPCI website. So it's a link to the Technical Assistance Guide and other resources. You can complete this at your own pace, so you can start and stop. If you are a physician, you can get CME credits for doing this. If you're a nurse, you get continuing education units. And everybody who completes this gets a certificate suitable for framing. We've all done it here. So we encourage all members of the sites to do it, and not just your clinical team. So have your front desk folks do it. Use it as a tool for onboarding for your patients at a medical home. When you bring somebody in and you try to explain what the patients at a medical home is, just say, you know what, I'm going to have you log on and do this training, and you're going to get a certificate just like the rest of us have. And it's going to give you a really good foundation as to what the PCPCH program is. So this is a really great resource, and it's free. Okay, so step 2, the day of the site visit. So what do we expect from you? Well, we expect you to keep breathing and to smile. We know it can really be an anxious time. We've all been through it, whether it's through PCPCH or whether it's through JCO or other organizations. We expect you to pull together thorough documentation for us so we can review that at the site. We'll also take a binder with us, so be prepared for that. So de-identify the binder that you've prepared for documentation during the site visit day. We'll take that. We can return it if you'd like, but we'll need to take that when we generate our report. We will need physical space to meet, and I know this is a challenge for some sites. Think about 4 to 6 patients plus a practice enhancement specialist for a focus group. Do you have a space for them to meet? We've been to clinics where they've closed during the lunch hour and everybody met in the front waiting room, which worked perfectly. So physical space for us to meet during the day. And also we want you to be honest. If you're really struggling with these measures, if you're lost, just tell us, because we can't help you if we don't know. We're here to help you. And if you're really having a great time with the PCPCH program and you've got some good innovation, be prepared to show us, because we're going to ask you, you know, what kind of innovations that you have going on here so we can share this. We're going to be looking for how you've met the standards. We're going to do that by looking at the documentation and also interviewing how you're innovating. And we're going to actually try to gather some patient and staff success stories. So that's a pretty important component as well. I'm going to turn it over to my buddy Chris here.
All right, thanks, Meg. So we talked a little bit about what happens before a site visit and how that gets planned, and then what happens during the site visit. And so I am sharing with you today what happens afterwards. So after the site visit is complete, a practice enhancement specialist will send you an email within about 10 calendar days. And so that email is basically to, thank you for your time. It's quite an endeavor to have a site visit team, in your clinic and interviewing and asking questions and having conversations with people. So we really appreciate that. Also included in the email is a survey on your site visit experience so that we can get feedback and improve how we do our work. We also provide you with any initial resources that we may have discussed when we were at the site visit itself. So sometimes there are some kind of low-hanging fruit type things that we can help out with and maybe send you some tools and resources with that initial follow-up email. And then we also plan for follow-up conversations related to specific goals that were identified during the site visit. And so this is more just kind of setting the stage for future conversations and how we might manage and work together on the work ahead. And then after that initial 10-day message, within 4 weeks, you will receive a complete site visit report via email. And the site visit report contains 5 main components. One component is an overview of your PCPCH story. So kind of what we do when we go to the site visit is we have a kickoff meeting where you tell us about your practice and how you came about the PCPCH program and what's been going on over time. And so we kind of learn about your practice and share what we heard. Another section is a one-sheet verification summary that identifies the verification status of each measure that you attested to. So it's just kind of a snapshot of your clinic's status in terms of the actual verification and point breakdown. Then there is a more detailed verification report that speaks to the content of the one-page verification summary sheet. So this is where we actually go measure by measure and share with you what we learned during our conversations and verification process throughout the day. So it's more robust, a lot more detail of our findings from that day. And then there's the clinical transformation consultant's report, and if you remember, that's the physician that comes along on the site visit, and they also share their input on the site visit. And that's also verification related, but really also speaks to more kind of strategic thoughts on where your clinic is and some things to consider going forward. And then finally, the last part of the site visit report is a summary of the patient interviews. So this is that section of time where the practice enhancement specialist has sat down with your patients and learned about their experience of your practice, and obviously we think that's key to any innovation efforts. Additionally, if your practice requires further work to meet any of the measures you attested to, we will also include an implementation letter with the site visit report. And so the implementation letter basically outlines the measures requiring action, next steps required on your part, for example, a written improvement plan sent to us, and a specific timeline within which your proposed improvement plan is needed, usually a 90-day period. So once your improvement plan is received by us, we review it, and then we get back to you and say, yeah, it looks like you're headed the right direction, go ahead and proceed, or, well, maybe let's talk a little bit more about it and work through it. And one thing I do like to point out is on that improvement plan, the 90-day mark, it's not that everything needs to be implemented and resolved in 90 days. That 90-day period is just to tell us where you think you're headed and what you want to try out in order to resolve those measures, and then we can, you'll be in contact with myself or Jill regarding that plan moving forward. Another thing I'd like to mention regarding the process after the visit is, as we visit various clinics throughout the state, there's an opportunity to capture best practices, and so it's really, in addition to the verification of your particular site, if there's something you're doing really well that we think is great, we might capture that and share it with other clinics, and vice versa. If we come to your clinic and we see something that might be helpful to think about or try out, we'd like to bring that your direction as well. So after you've received your site visit report and identified specific goals for improvement, a practice enhancement specialist is available to support you in your goals. So help can include things like getting you tools or templates that you might want to try out in your clinic, or getting you in touch with people or organizations that have been down the same road and can maybe provide some support with whatever those goals might be. And I would also like to highlight the fact that while there certainly is an audit or verification aspect of what we do, we're also here to support your improvement efforts any way that we can, and are really excited about your efforts to promote high-quality patient-centered care. So we appreciate all the work that you're doing every day toward that end. So at this time, I would like to welcome Cassie Zosel and Kiana Hartnell from Corvallis Internal Medicine. So we visited Cassie and Kiana back in August, and we wanted to have them on this webinar so they could share their experience with us. And so thank you for participating, ladies, and I'll go ahead and ask a couple of questions of you, and if you could just share your experience with us, that would be great.
Sure, no problem.
You're on, both of you?
Yep.
Great. Okay, thank you. So the first question is, what was the process like preparing for the site visit?
Well, it was, I'm not going to lie, it was time consuming. But it was mostly just gathering information, going through what we had already attested to, and then trying to provide documentation of that. So it was mostly just gathering everything, getting that organized, and making sure that it did reflect what we had attested to.
Okay, great. Thank you. So the next question is, how was the actual site visit day for your team?
It was not as bad as we had anticipated. We were concerned. I think that there's some questions when you hear Oregon Health Authority and they're coming to talk to you. It's kind of scary. And we learned real quickly that you guys are all very nice people who are here to help us.
Great, I appreciate that. No, that's good to hear. We definitely want to be helpful and supportive, and so thank you. Thank you for sharing that. One thing I did mean to ask you for the benefit of our listeners actually is, if I could back up just a moment, I meant to ask you to go ahead and introduce yourselves and your roles at the clinic and exactly what kind of clinic you are, if you could take a few minutes just to do that.
Sure. I'm Cassie Zosel, and I'm the office manager here. Been here 7 years. We're a pretty small practice. We're internal medicine, of course. We've got 1 MD and 2 PAs, maybe 12 employees in all. So. And then my name is Kiana Hartnell, and I'm a medical assistant, certified medical assistant, and I'm the clinical manager, and I've worked for the office in many different aspects, but and have been here for about 14 years.
Great, thank you.
Really quick, sorry, this is Kate. There were some questions for them, so I thought maybe we could take those now rather than before we move forward. Is that all right, Chris?
Well, can we finish the ones we've got? I think they'll be pretty short and sweet, and then I think that would be fantastic if people could kind of jump in and talk to them. Yeah, absolutely.
Okay, perfect. Thanks. Just let me know.
Yeah. No, absolutely. That's great. So the next question is, can you describe the follow-up support from your perspective? So kind of after the site visit.
Yeah, the support has been wonderful. And it's great to have like an actual person or point of contact. So we've mostly been talking to Chris and Megan there after the site visit. And I email or call with any questions at all. And it's been a huge help.
Well, great. Thanks. That's great feedback. And for our listeners, I didn't pay them to say that. So 2 more questions. What would you do differently now that you've had a site visit? If you could do it all over again, how would that look different to you?
I think that we probably would have utilized the support ahead of time. Like I said before, you're kind of concerned that these people are going to come in and bite you or something, I don't know. And so we feel like if we had realized how much we could utilize them ahead of time, we could have asked a lot of more questions. There was one particular thing that Cassie and I spent a good amount of time trying to figure out. And if we had just called and said, how do we do this, they would have told us we didn't have to do it in the first place.
So it sounds like maybe just being more aware of the support that would have been available prior to the visit if you had maybe just known that it was there and available.
Right. Correct.
Okay. Great. Okay, thank you. And our last question is, any tips to offer sites as they plan for their own visits?
We would definitely tell everybody to relax. It's not going to be as bad as you think it is. You kind of feel like you've worked really, really hard for so long to get all this stuff in place, and you're not even sure if you really did it right, but you know that you've put in a lot of hours for it, and then somebody's going to come in and judge you for it and might tell you that you've been doing it wrong. It's a lot of pressure. And then everybody gets there and is like, oh, you've done such a great job and been really supportive, and I just say relax, see what happens.
Great, thank you. Anything else to add?
No, I think that's about it.
All right. Well, thank you very much. I appreciate you taking the time. And Kate, did you want to go ahead and open it up for some questions to the clinic itself?
Yeah. So there are just some people who were curious if you could say more about what was time-consuming to prepare, if you could talk specifically about that. And then the other question was, did you already have, if you don't mind sharing, did you already have a binder prepared, or was that something that you did once you knew that you were going to have a visit?
No, we did not have anything prepared as far as we had policies in place the way that they were written for certain things, but we didn't have any of the documentation to support that, like certain reports and different things. So we actually did our binder and gathered all the reports and information to support our policies right before the site visit. And so I think that's what was so time-consuming, was just the gathering of information. We had to have dedicated time for that outside of what our normal clinic duties are every day.
Okay. Any more questions for the clinic?
Not yet.
Okay. So we're going to go ahead and we will open it up for Q&A towards the end as well, so keep that in mind for our listeners there. So now we'd like to transition to frequently asked questions about site visits. So I'll start off the first question we have. The first question is, do we have to close the clinic for the day? So the answer to that is no. We know that having a site visit requires pulling some of your clinic staff away from routine duties, and we strive to be as unobtrusive as we possibly can. We schedule 45-minute meetings with different dyads or teams staggered at different times to minimize the impact of the interviews. So we know that you have a lot of work to do, and we try to arrange things to be as seamless as it possibly can be.
Great. Okay, next question. This is Meg. Do we need to recruit patients? And the answer to this is yes. We do hold that patient focus group around noon, and we need to reach out to, like I said, 6 or 8 patients with whom you think would be interested in participating. Ideally, we'd like to have 4 to 6 patients to speak to during that time, and one of our practice enhancement specialists will ask the patients questions related to those core attributes of the patient-centered primary care home program. So we think that this can be one of the most valuable parts of the day, and it certainly can be one of the most emotional. It is not uncommon to have patients, when they have a forum where they can share freely and comfortably, cry and with joy, with how happy they are with the practice. And we transfer that joy back to you at the report out at the end of the day. And we also put that in the report. So it's not uncommon to have a little bit of a wet eye at the report out too, with when the clinicians really hear from what the patients are saying. So it's an important part of the day. Okay, next question.
All right, this is Evan. Go ahead and take this one. Do the clinicians really need to be involved? And the answer to that is yes. So we completely understand that the clinicians are primarily the moneymakers in the clinic, and the production folks. And so it can be difficult financially to take them out of seeing patients for any period of time. However, when we go to these site visits, we speak with everyone in the clinic. Again, we speak with patients, we speak with front office staff, with medical assistants, nurses if you have them, the clinicians, behavioral health folks, whoever, all the folks who patients interact with. And obviously, the clinicians, the primary clinicians, are perhaps, the most important, or certainly a really critical point of contact for patients. And so, yeah, we have to talk to those folks who are doing the work. And we try and limit that to, only what we need, and allow you to sort of stagger some of these interviews and things like that to really fit with what the schedule that will fit with the clinicians.
Great. So I'll take the next one. This is Chris. Is this an audit? So we've touched on this a little bit. These visits are a time to verify that the measures that were attested to on your PCPCH application are indeed being met, and to learn how your clinic has implemented the measures. But above and beyond the verification piece of what we do, we also use the site visits as a springboard for providing technical assistance, supporting your clinics in achieving goals, and facilitating primary care transformation.
Okay, this is Meg. Is there flexibility with the visit agenda? Yes, of course there's always flexibility with the visit agenda. Our visits typically start at 8:15 in the morning. We can start a little bit earlier if you need to, or even a little bit later. And we're acutely aware that you still need to provide patient care during the site visit. We'll be flexible with our schedule, but we want to make sure that we have plenty of time to interview appropriate staff and verify documentation. So yeah, we'll work together with you to make the agenda what you need it to be for the day.
All right, this is Evan, and I'll take the next one. Do I have to have a site visit? Participation in the patient-centered primary care home program is completely voluntary. You guys you stepped up to do this, and as part of that, when you signed the application, you agreed that that a site visit could happen. And again, we explain why that's important, certainly for the integrity of the program and for the integrity of the recognition that you receive. In order to really understand how the standards and measures are implemented in practice, we do need to go out to the visit to verify the standards and speak with your staff and all the folks that are doing this really hard work. We really are trying to design these site visits as something that is as beneficial to the clinics as it is to the program. And again, as part of this, as hopefully you've learned through this webinar, we really do work with you to provide resources so that you can do this patient-centered primary care work going forward.
Okay, this is Chris, and the next question is, why are we doing this? The site visit is an important component of the program, and we need to verify that measures are being met in order to protect the integrity of the program. We're also looking for innovation in the field, and we bring resources to help sites that are struggling to meet the measures or would like some additional support in continuing to transform their practice. So really, the site visit is kind of an initial part of the program where we really start to build a relationship and support the sites and help them get to that next level.
Okay, this is Meg. If we aren't meeting some of the measures, will our tier level drop? This is a big question. We get this a lot. It's not uncommon for a site to need to submit an improvement plan after a site visit. If you are not meeting some of the measures that you attested to on the application, your clinic will have 90 days after you receive your report to draft and submit an improvement plan and start to implement those changes. Let's put this in perspective. So if you had a site visit yesterday, you would get your site visit report somewhere around the first week of November. So at that time, then that 90-day clock would start for the improvement plan. But Chris and Jill will have already reached out to you and going to start to work on things that were in that improvement plan to start to move you forward, move you down that path. So in essence, you would have 4 months from the time of a site visit to work on that improvement plan, but we don't want you to wait until 3 months and 15 days. We want you to start right away while you have momentum, while we're here to help along that process. So if you choose to not implement an improvement plan, then it is possible that your tier level could drop. Our goal, though, is to help provide support and input from the PCPCH site team during that 90-day follow-up period. And our technical assistance extends at least up to 6 months after the site visit, and that also includes support from that clinical transformation consultant, that physician that we're bringing with us.
Okay, and this is Chris, and I will share the last question. Who will get the report, or will we get a report, and who sees that? Yes, you will get a report. It is a comprehensive written report within 4 weeks of the site visit. The report includes a recap of the visit, including an overview of the patient interviews, areas that require further verification, and recommendations for improving upon clinic goals from the clinical transformation consultant. And the reports are shared only with Oregon Health Authority and clinic staff.
And this is Evan. If you look at this slide, you'll see that this is what I say at the end of every site visit, actually. We're doing quality improvement here in our program all the time as well, just like you guys. We're trying to get better. So we have 9 questions on our top 10 frequently asked questions slide. So I'm sure you all could probably chime in with questions that will give us a 10th to put up there, questions that you all have about the site visit process, for, during, after any of that, as well questions that you may have for Corvallis Internal Medicine, who again has thankfully taken time out of their day to join us here on the webinar. Kate, I'll turn it back to you.
Yeah, so we do have a few questions, and then again, the GoToWebinar control panel, the questions pane, we have about 13 minutes left to take questions, and as a reminder, one question I got, the slides and the recording of this webinar will be available by the end of the day on the Institute website, and everybody who's registered automatically gets an email with a link to that, so you will have access to that. And that's also a good reason to ask any question that might be lingering in your mind, because it's sort of a gift that you'll give to anyone who may be watching this webinar in the future. So go ahead and type your questions in. I'll start with some of the ones we have already. The first is for the folks at Corvallis Internal Medicine. As a guest, how many hours would you say it took you to prepare for your visit?
Well, we probably, I would say like 2 days total, but that probably had a lot to do with the fact that we weren't sure exactly what we were, or you guys were looking for at the site visit. So again, we should have utilized the support more ahead of time to kind of figure out exactly what you were looking for and trying to, I don't know, interpret it. Great.
And then anyone from the PCPCH program team have anything to add about the number of hours it takes to prepare for a visit, or does that seem to kind of get at what you've heard others say?
Yeah, this is Evan. I think it really depends on what clinics have done ahead of time. So clinics that when they attest, if they essentially convince themselves that they can show themselves documentation of that they're meeting the standards and essentially put together a binder as they're attesting, that will make the site visit process a lot easier, because they'll already have that binder essentially together. They may need to kind of go through if it's a year later and say, oh, you know, do I need to run that report again or whatever, but that would make the process a lot easier if folks anticipate a site visit essentially when they're attesting.
Okay, great. Then someone asked about the patients that you recruit for the focus group. Are there guidelines about what patients to recruit, or does the clinic just use their judgment? Is there any specifications that you would suggest for that?
No, that's a great question. There are no specific guidelines as to which patients to choose or what kinds of patients to choose. I would say that, the most kind of useful conversations come from patients who really do utilize the breadth of the services offered. Even complex patients with a lot of medical needs, because someone who's utilizing services to that extent is going to have a lot to say about those services. So that's great to have people like that. But other than that, I would say there's no guideline. You can pick whomever you like, as long as it's someone that comes to your clinic and utilizes care.
Sorry, can I just add? One thing I would just add is, probably one guideline would be, and this is maybe kind of common sense, but somebody who can interact fairly well in a group, right? So that's one thing, that not somebody who's going to talk for 30 minutes or create problems in a group. And then ideally, it would be folks who are somewhat reflective of your practice, who again, that may seem just a no-brainer, but if your practice is kids, we're going to hope to meet with families that, and parents, obviously. If your practice is seniors mostly, meeting with mostly seniors makes sense. If your practice is really diverse, well, it'd be great to meet with a diverse group of folks as well. So ideally would just reflect your practice, but those are maybe common sense things for folks.
Yeah, those are good thoughts.
And someone else asked, just to follow up to that, how hard or have clinics struggled with getting patients to come and participate in a site visit?
This is Meg. We've had some pushback from sites that they didn't quite know about how to go about inviting patients to participate. So we put together a frequently asked questions list again for patient recruitment that we will send around. And actually, we just received a really good resource from a site visit last week that I'm going to ask permission of the site to be able to de-identify and share in our toolbox, because it's a really great form letter that they've used explaining the focus group for the day and what the ask is. So we do have other tools like that we can provide.
And patients actually really do show up. If the clinics present it as, hey, we're participating in this program, which is about making care better, and an important part of that is interacting with patients, and so we have these folks come and visit our clinic that we'd like you to talk to. If the clinic presents it in that way, patients most of the time are like, oh my goodness, sure, what can I do to help? Obviously people are busy and all of that, but people really do show up and share openly and really, I think, provide a great perspective for clinics, a perspective that they don't often see.
Yeah, and another thing to keep in mind with the patient interviews is that it's always a situation where we've run out of time to talk. We've never run into a situation where we're interviewing patients and then there's nothing left to say or they don't have anything to share. We always, we enjoy it. It's probably one of the most enjoyable aspects of the work, and they always have plenty to share, and so it's a good time, and it's a very valuable part of the visit.
So then there were a couple of questions just about how clinics get selected for site visits, so I'm just going to kind of roll them all into one. The first is, how often should a clinic expect to be getting picked for a site visit, and are there intervals, and does that make a difference if someone had a visit under the 2011 standards and then is reattested in 2014? And the second question in that sort of same realm is, can clinics request to have a site visit, or how are people selected?
Right. Great questions. This is Evan. So first of all, how often? So we are ramping up to, we have the capacity to do about 100 site visits a year or so right now. In our program rules, it says that we will visit clinics a minimum of once every 5 years. This is a little personal editorial. I think that my goal is to visit clinics once every 3 years, but it's not like we're coming back every month. That being said, there are situations that could come up, for example, in the improvement plan time, where we may actually, if you're really struggling with an improvement plan, where we may come out and it's really to help you all do that improvement plan work. It's a minimum of once every 5 years and potentially more often. but it's certainly not frequently. This isn't a yearly process or anything like that. In terms of how clinics are selected, so they're essentially selected on a semi-random but informed basis. We've broken the state essentially into regions to make sure that we do visit clinics in different parts of the state. Through that process, we essentially do pick clinics, again, pretty randomly in those geographic regions. We do try to, avoid, like, through some random process, getting all our clinics site visits in Southern Oregon and Medford or something like that. So again, we do. It is somewhat of an informed process, but essentially it's a fairly random process. There's very little that that we can say about patterns or anything like that. We do try and visit clinics just essentially geographically and make sure that we're hitting all different types of clinics in the state. Right now, as of today, we don't have a process where clinics can request a site visit. However, through the new Tier 3 star recognition process, which is going to start in November, part of that process, that's that recognition process to really recognize really high-performing clinics, so clinics that are doing really outstanding work. As part of that process, clinics have to have a site visit, so essentially they would be requesting a site visit if they want to be recognized as a Tier 3 star clinic. They would be requesting a site visit there. But it's an interesting question in terms of thinking about, can clinics request a site visit that are not participating in that process. We don't have that available at this time.
Great. So one of the questions, and again, we have just a couple of minutes left before 9 o'clock. If folks have any lingering questions, I would encourage you to get those typed into the questions pane in the GoToWebinar control panel. People watching this recording in the future will thank you for asking a question that they won't be able to. So no question is silly. Go ahead and type them in. One other question was, if there's a caregiver to a patient, would that be someone who could participate in a patient group in the future? If this clinic were site visited, could they invite caregivers since they're often talking with them?
Yes, absolutely. That's a great question, and yes, they're very welcome to participate in those patient focus groups. So oftentimes we'll have a patient and a spouse or a partner or somebody that comes along with them as well.
Right. I guess it would be, I would describe it as a patient, family, caregiver
focus group. Yeah.
Focus group, really.
Yeah, we've had a lot of married couples, family members participate, and that's absolutely fine. Yep.
Great, and then there was some people with some direct questions about their specific clinic. So is there any way that, if there's someone who is overseeing a large group of clinics, they really have no way to know when they might be site visited? Is that right?
Correct. Yeah, it's correct. Yeah, the short answer is yes.
Okay. How far in advance are the site visits scheduled?
We like to give 4 to 6 weeks notice that the site visit will be scheduled. So.
Let's see. So, and then someone else asked, does the organizational contact also receive notification if one of their practices is selected for a site visit? The person's comment was just that with turnover in clinics, especially during a 2-year certification cycle, it would be really helpful to have the organizational contact receive those notifications.
That's a really good question, and our contact to alert a site that we're coming for a visit is the same email address that is on the attestation report, and that's not uncommon to have that person who filled out that report then have turnover and have left the clinic. So we do a little bit of sleuthing, and we figure out how to get the best contact at the site. In a perfect world, if there was a managing group, I would love to let them know as well. But we call on that right now of the person who we notify. They can notify whomever they want to know that we're coming. And then they can be involved in the planning meetings moving forward. That's absolutely happened on the calls. So.
Right. So in terms of the organizational contact, obviously we wouldn't necessarily know who those people are unless they were, our program was informed of who they are. And so again, if that does change over, it's fine to go ahead and notify our program and say, hey, if you need to reach somebody about anything, now I'm the contact for this group of clinics or whatever. That's great to let us know that.
Right, that's great. We do keep a master tracker, so it'd be very welcome to have that information.
Great. So we are right at 9 a.m. And again, a recording and a copy of the slides will be posted today. You can also visit the PCPCH program website, primarycarehome.org and .gov, and there is a post-webinar survey. We'd really love to have folks complete that. If they could, it helps us plan great webinars in the future. Anything else, PCPCH program team, before we sign off?
No, just a huge thank you to Prevalence Internal Medicine and Kathy and Tiana.
Yeah, thank you.
Thank you very much for joining in the call with us and sharing about your experience. We appreciate it. Absolutely.
Great. All right. Well, thank you to everybody for joining the webinar today, and I hope everyone has a great day.
Thank you.
Thanks. Bye-bye.